Health and Human Services, HHS, is going to get a massive makeover. Secretary Robert F. Kennedy Jr. said he is going to be consolidating and downsizing, and we're going to get something called AHA.
We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA. We have two goals. The first is obvious, to save the taxpayer money by making our department more efficient. And the second is to radically improve our quality of service.
According to a video announcement posted today, Secretary Kennedy said this massive restructuring of the Health and Human Services Department is necessary because he says the bureaucracy has gotten out of control. This restructuring is going to require firing another 10,000 full-time HHS employees. That's on top of the nearly 10,000 that were already cut by DOGE. On top of those personnel cuts, Kennedy says, HHS will take its current 28 divisions and will consolidate them down to 15 new divisions. He's also cutting the number of HHS regional offices in half, from 10 to 5. Kennedy claims all this restructuring is going to save American taxpayers almost $2 billion.
The entire federal workforce is downsizing now, so this will be a painful period for HHS as we downsize from 82,000 full-time employees to around 62,000. We're keenly focused on paring away excess administrators while increasing the number of scientists and frontline health providers.
A fact sheet provided by HHS says the FDA will decrease its workforce by 3,500. The CDC will decrease its workforce by 2,400. The National Institute of Health will decrease its workforce by 1,200. And the Centers for Medicare and Medicaid will reduce its workforce by 300. As for this new AHA agency, Kennedy says it will combine multiple existing agencies that are already within Health and Human Services, including Substance Abuse and Mental Health Services, the Agency for Toxic Substances and Disease Registry, National Institute for Occupational Safety and Health, and more. Now, those who are part of Kennedy's Make America Healthy Again movement have praised today's announcement, but what is this going to mean for you? Well, we're going to have to wait and see how this all shakes out. But health advocates, including those who advocate for Medicare and Medicaid recipients, child health advocates, and infectious disease experts warn that massive cuts like this will absolutely impact all kinds of services that are available to the American public through the Health and Human Services Department. It will impact cutting-edge research and vaccine and treatment development for serious diseases. Kennedy says these cuts are necessary, and he is standing by this decision.
We are the sickest nation in the world, and we have the highest rate of chronic disease. The U.S. ranks last among 40 developed nations in terms of health, but we spend 2 to 3 times more per capita than those nations. We're going to streamline our agency and eliminate the redundancies and invite everyone to align behind a simple, bold mission. I want every HHS employee to wake up every morning asking themselves, what can I do to restore American health today?
So if you want to read more about these cuts to HHS, and if you want to see more about the restructuring of all of this, and you want to see that fact sheet that HHS provided, I'm going to email all of that out to you in tonight's Facts HQ email, so make sure you sign yourself up.